Welcome back, ladies and gentlemen. I'm your host, Max Weisky, with Barnes News. I am joined by today Jessica and Marin. Welcome. Today we're covering a critical and life-threatening topic, hemorrhagic strokes.
Well, Max, that sounds really terrifying.
It sure is, Jessica. We'll be discussing what a hemorrhagic stroke is, how it manifests, and how healthcare workers work to manage it.
Well, here to help us understand a little bit more about a hemorrhagic stroke is our medical expert, Phoebe. Welcome, Phoebe.
Thank you for having me. It's a pleasure to be here.
Well, Phoebe, let's get to it. Can you tell me what happens to the brain during a hemorrhagic stroke?
Yes, a hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing blood to leak into the surrounding brain tissue or the spaces around it. This disrupts the normal flow of blood and oxygen, leading to both direct injury from the blood itself and increased pressure inside the skull. This pressure can damage healthy brain tissue and lead to severe neurological problems.
Sounds awfully deadly. What causes a blood vessel to rupture like that?
The most common cause is high blood pressure or hypertension. Over time, the constant high blood pressure will weaken blood vessels, making them prone to rupture. Other causes include aneurysms, which are bulges in the blood vessel walls that can burst, as well as arteriovenous malformations or AVMs. That is where blood vessels are abnormally connected. In some cases, even head trauma or overuse of certain blood thinning medications can also lead to a rupture.
So when a blood vessel bursts, like you said, what happens?
Yeah, so when the blood escapes from the vessel, it pools in the brain, creating pressure, and this pushes against the surrounding brain tissue, and it can kill brain cells. And the blood itself also irritates the surrounding tissue, especially because as it's broken down, there's harmful byproducts, and this causes inflammation. As the bleeding continues, the pressure inside the skull increases, which then reduces blood flow to the other parts of the brain, causing damage there as well.
You know, there's all this talk in the body about it trying to find a balance between things and trying to maintain homeostasis. When something like this occurs, how does the brain adapt to it?
Yeah, so our brain responds by triggering an inflammatory reaction to try and repair the damage. The interesting thing is this sometimes ends up worsening the injury. Um, I already talked about the blood breaking down into toxic byproducts, which exacerbates the damage. And depending on where the stroke occurs in your brain, the symptoms can vary greatly.
What are some symptoms we should look for if we think someone might be having a stroke?
Some common symptoms include difficulty speaking, loss of sensation or muscle control on one side of the body, disorientation, and drowsiness. Severe cases can even lead to a stupor or coma. A really useful acronym that we like to tell people because it's easy to remember is FAST. So the F stands for facial drooping, the A is for arm weakness, the S is for speech difficulty, and the T is for time, meaning once you see all of those things, it's time to call 911 and get help immediately.
For our viewers at home, here's a visual diagram for you to look at to more easily understand these symptoms.
So you said a little bit just previously about how with a hemorrhagic stroke, other organs and stuff can be damaged. Would you say a heart and a lung can be damaged in that case?
Yes, you're absolutely correct. There is a condition known as stroke-induced immunosuppression, which weakens the immune system, making patients more susceptible to infections, including pneumonia, which would affect your lungs. And strokes can also affect the heart, leading to complications like arrhythmias and even heart failure.
Okay. So let's assume that with our acronym FAST, we go to the T and we've already called 911. And the patient's transported to the hospital. What are how can the hospital and the doctors begin to help a patient out once they're already have those other issues like the pneumonia or the arrhythmias in their heart?
Yeah, so complications can be managed with treatments like antithrombotic therapies to prevent further clots and anti-arrhythmic drugs, which would manage heart rhythm issues. And in severe cases, there's even surgical interventions like stents or coils that can be deemed necessary.
Thank you, Phoebe, for your expert opinion on this topic. So, as Jessica mentioned, this patient is at the hospital and they're first presenting. They're just coming in through the ambulance. From the perspective of an ER nurse, is it okay if we do a visual demonstration for our viewers to see how an ER nurse might be handling this situation?
Absolutely. Let's give it a try.
All right. Marin here is going to be our model, and we are going to do this mock ER nurse assessment. Okay, now we're going to have Marin actually demonstrate a hemorrhagic stroke. So if you would like, you can start right about now.
Okay, let's go.
Okay, so as a nurse, what would be the first thing I'm doing with Marin here?
So when a suspected stroke patient arrives at the hospital, the ER nurse is going to perform a head-to-toe assessment. First, we're going to check her blood pressure, though, because we're going to want to get her vitals. And in hemorrhagic strokes, the blood pressure is often elevated.
Okay, as a nurse, I think this is what I would be using to measure blood pressure. So I would listen in, do all of that. What would be an elevated blood pressure? Would that be something like 180 over 10?
Uh,
110?
yeah, that's actually dangerously high. So that's a great example. And next, you would be assessing her level of consciousness and orientation by asking questions like, what's her full name? Does she know where she's at? Things like that.
Marin, do you know your full name?
Tato's farm dog, right?
Yeah. Do you know where you are here today?
Blue sky right car.
Okay.
Okay, so this is a great example of aphasia, which often presents in left hemisphere strokes. This would be where they're maybe not understanding words that are being spoken to them, or they even think they're responding to you with the correct thing, but they may be mixing up words with just random words from their vocabulary.
Oh, I see. That's really interesting. I didn't know that.
Yeah, so next, how about we test some cranial nerves? So you'll start by testing cranial nerve number 7 by asking her to smile or frown in any facial expressions.
Okay.
And we'll test cranial nerve number 5, which is our trigeminal nerve. And you'll have her clench her jaw and you'll feel her muscles to see if you can feel if she's clenching on both sides. And also touching an object on either side to see if she's feeling it.
Okay. Could I have you smile for me? Frown and raise your eyebrows.
Great.
Okay.
And one thing that we obviously cannot recreate on purpose is that facial drooping. We're just not able to make our muscles do that, but it would be very obvious when she's smiling that only half of her mouth is going up and the other side is not moving.
Oh, I see. Kind of like the facial drooping in FAST, the acronym.
Yes, that's a
earlier.
really good picture you guys have on your example there.
Yeah. Okay. Well, we'll go ahead and have her clench her jaw. Could you clench your jaw for me? And I guess I'll feel the muscles in the jaw.
Mm-hmm.
Okay. So I'm feeling the muscles in the jaw. What am I feeling for?
You're just feeling to see kind of like the muscle strength. You're feeling if she is actually clenching on both sides or not. And you'll kind of feel that rigidity on the side that still has strength and nothing on the other.
Got it. And light touch, we can go ahead and test that. Could I have you close your eyes? I'm gonna lightly touch a pencil against your cheek. I want you to tell me what side I'm touching on, okay?
The left.
Okay. Can you feel that?
No.
Right.
Mm.
Can you feel that?
No.
Can you feel that?
Yes.
Right. What side was that on?
Left side.
Okay, so it seems she has no feeling on her right side.
Yes, that is very consistent with what we would be seeing. And then we'll test for motory and sensory function in her extremities. So maybe have her try to lift her arms.
Okay, could you just lift your arms for me real quick? Oh, okay, I'm noticing her right arm isn't going up exactly. I'm gonna hold both your arms
Okay.
up, and I just want you to hold this up in the air
Okay.
for me, okay? Okay, it seems like her arm fell. You can go ahead and relax. Can you feel this?
No.
Oh, okay. What does that tell us, Dr. Phoebe?
Yeah, so this is indicating a complete loss of her motory and sensory function on the affected side, and this is very common for a patient, especially with a left-sided stroke.
Well, thank you so much, Phoebe, for guiding us through that demonstration. It is very clear that a hemorrhagic stroke is super dangerous and should require immediate attention.
Yes, early recognition and treatment are crucial to improving outcomes.
And to our viewers at home, remember this FAST acronym. Remember to act quickly, and if you suspect that someone is having a stroke, timely intervention can help save their lives. The quicker you intervene, the better outcomes they might have. Phoebe, is there anything you want to let us know before we let you go?
Just please do not hesitate to consult your doctor if you have any concerns, maybe based on your family medical history. Talk to your doctor, see if you have any risks for a hemorrhagic stroke, because the more informed you are, the better you can take care of yourself and hopefully prevent this.
Well, thank you, Phoebe, for sharing your expertise today.
Thank you. Thank you very much.
Thank you.
It's my pleasure. Please stay informed and stay healthy.